How to interpret brain CT scan results. Imagine you're looking at a detailed map of the brain, and your goal is to understand what it reveals about a person's brain health. When a doctor orders a brain CT scan, they want to see if there are any signs of injury, abnormal growths, or other issues. Interpreting these images involves a careful step-by-step process to ensure nothing important is missed. First, it's essential to confirm the patient's identity, the date of the scan, and the type of scan performed. Most often, a non-contrast axial scan is used initially to get a clear picture of the brain's structures. The images are taken in slices, and the radiologist will look at different planes, including axial, coronal, and sagittal views, to get a full understanding. Next, the radiologist assesses the difference between gray matter and white matter. Normally, gray matter appears brighter because it's denser, and white matter is darker. If this distinction is blurred or lost, it could suggest early signs of stroke or brain injury. Special attention is given to areas like the insular cortex and basal ganglia, which are sensitive to early damage. Then, the focus shifts to identifying abnormal densities. Bright areas on the scan, called hyperdensities, might indicate bleeding, such as in a hemorrhage or calcifications that are sometimes associated with tumors. Darker areas, known as hypodensities, can point to swelling, fluid buildup, or tissue death within a tumor. The radiologist also looks for signs of mass effect, which occurs when a tumor or swelling pushes against normal brain structures. This can cause parts of the brain to shift from their usual positions, a sign that the condition might be severe. The ventricles, which are fluid-filled spaces in the brain, are checked for size and symmetry. Enlarged ventricles could mean hydrocephalus, a condition where fluid buildup causes increased pressure. The skull and soft tissues surrounding the brain are examined too, especially in bone window settings, to detect fractures or destructive lesions that could be related to trauma or tumor invasion. Adjusting the window settings on the scan helps visualize different tissues better. The brain window enhances soft tissue contrast, making it easier to see gray and white matter differences. The bone window focuses on the skull and facial bones, while the soft tissue window helps evaluate the scalp and sinuses. When it comes to tumors, they often appear as focal masses that may have surrounding swelling or edema, which shows up as darker areas around the lesion. Sometimes, tumors contain calcifications or show contrast enhancement if a contrast dye was used, helping to distinguish them from other abnormalities. It's important to interpret these findings in the context of the patient's symptoms and medical history. For example, if a person has neurological deficits, the scan findings can help guide further testing, like magnetic resonance imaging, which provides more detailed images of soft tissues. For brain tumors, CT scans are a valuable first step, but they are often complemented by other imaging techniques and biopsy procedures to confirm the diagnosis. Remember, while CT scans are quick and useful, they do have limitations, especially in detecting very small or subtle lesions. That's why a detailed report from a radiologist and consultation with a neurologist or neuro-oncologist are crucial for accurate diagnosis and treatment planning. In summary, interpreting a brain CT involves checking the overall brain structure, looking for signs of bleeding or abnormal growths, assessing the ventricles and skull, and understanding how these findings relate to the patient's clinical picture. Always keep in mind that each person's situation is unique, and medical decisions should be made in collaboration with healthcare professionals. If you or someone you know is undergoing a brain scan, it's best to discuss the results with a qualified doctor who can interpret them accurately and suggest the most appropriate next steps for care.